everybody. Happy middle of the week, and we're well into October now. So I know many of you are in the throes of getting started with your open enrollment, your annual open enrollment. We are going to have a very busy power lunch today. And I know for those of you joining maybe for the first time, we have a lot of new people on that registered. These are supposed to go 25, 30 minutes. This particular one is going to go a little bit longer. Feel free to jump off. We will have a recording of the webinar available, and my slides will be available to those who registered as well. So no worries if you have to jump off a little early. I think this is probably going to take me maybe 35 minutes to get through instead of 30. But today I wanted to, ironically, we did a power lunch with survey results last year on October 11th. So it was kind of funny. I found the PowerPoint that we did last year, and yesterday I was kind of going through it. And I think the thing that struck me was the change in paradigm and the shift in thinking. So we're going to talk a little bit about what's happening in the industry and why that's important to the way that we think about benefits. We're going to talk about the state of the market and what's driving our strategy and what the trends in the survey results are. And then we're going to go through the top categories of things employers are doing in 2019 with their strategies. So they're focused on a shift from looking at benefits and cost shifting to the employee to more of a holistic well-being focus and what benefits in the whole workplace mean to us. And I think a lot of that has been driven with the unprecedented low unemployment of under 4% for the first time in 15 years. So we're going to focus on a lot of these things, but the state of the market today is that there's a couple of things that are specifically driving cost, and a corporate strategy of wellness is it's being outdone by the high cost of pharmaceuticals, the new treatments for our oncology, and some of the other things where the pharmacogenomics are coming into play, which is a step beyond the specialty drugs that we've been worried about for the last 12 to 18 months. We have mergers and acquisitions that are driving change in the marketplace. So it's really quite a monumental shift in the last 12 months that we're going to talk a little bit about today. So I wanted to start, and some of you have seen this slide before, but the insurance companies and the pharmaceutical benefits managers, the PBMs, they're all shifting their focus. So if you look at what's happened the end of last year to the beginning first quarter of this year in 2018, we had a shift in the marketplace. And when you look at them one by one, you really don't get the full grasp of the story of what's going on behind the scenes. But I look at all of these changes and all of these mergers and acquisitions, and it says two things to me. It says, one, the insurance companies are trying to garner market share, right? So if you look at the insurance companies, they're coupling back up with the pharmaceutical carriers to kind of garner market share. So that's the first thing that's happening. And then the second thing that's happening with these mergers and acquisitions is the shift in the way that healthcare is being delivered in the United States today. So we have 5 generations of people in the workforce, right, for the first time. We have 55 million millennials, and the shift in the focus on the carrier side has been driven by the demand on the employee or the member side. And really what the members and the new workforce, if I want to call it, is demanding is they don't want to wait 3 months to get a primary care physician office visit. They want to look at their smartphone and say, I've got open Tuesday at 10. Can I get a doctor's appointment Tuesday at 10? So they're looking for employers to deliver a different kind of healthcare benefit. They're looking at telemedicine. They're looking at, if you just take some of the acquisitions, the CVS Caremark Aetna acquisition, a large part of their strategy is to clear out retail space, right, and put those minute clinics in so that people can get primary care or non-urgent care at the pharmacy in their minute clinics. They're going to be able to see a PA or a registered nurse, or in some cases a physician. So they're looking at how can they be more on demand. And then if you look at the third acquisition on there, the Amazon, Berkshire Hathaway, JP Morgan, they're undoing the traditional venue of delivering insurance and delivering healthcare. So their model is really, it's the Amazon way. It's Prime. It's delivered right away. It's delivered the next day. It's crazy. You can go online shopping and the merchandise is delivered to your front door the next day. So they're looking at moving that into the healthcare arena, and they're looking at trying to push forward a change in the way that people are getting healthcare. And they're doing it for their employees initially, and then I think they're going to roll that out to the marketplace. And if you look at some of the acquisitions Amazon's done in the last 2 to 3 months with some of the pharmaceutical licenses and trying to get people to be able to buy pharmaceuticals and have them deliver the next day via Prime, that is definitely something that's going to, again, shift the paradigm on how we're getting healthcare and shift the focus and really shift the expectation. So I kind of wanted to just kind of put that out there kind of as a table setter for what we're going to discuss and what the survey shows this year, because it has significantly changed. And how it's significantly changed is employers are really not looking at just benefits as healthcare benefits anymore, and they're looking at a holistic approach. They're looking at the mental health aspect of their population. They're looking at how quickly people can get care. They're looking at ways of looking at catastrophic care, chronic illnesses, and trying to figure out how do we meet the needs of our population in a holistic approach. And some of the things that are being carried into the workplace are the financial stresses people are feeling, and how they incorporate voluntary benefits into their benefits strategy with tuition reimbursement, pet insurance, phone insurance. Those voluntary benefits are very important to the millennials in the workplace. They statistically in surveys have showed that they value voluntary benefits higher than they rank their medical insurance. So it's really interesting because we really have to look at the workforce, what the expectation is, and how to better deliver it. And I think, again, pushing that I've seen over and over and over again is the low unemployment and the shift in the meetings that I've had on strategy with employers of it's not, how do we get the cost from 5% out of the gate down to 2 or 3%. So it's budgetable management. It's really how do we keep our employees happy so that we can retain our good talent and grow our business and recruit. So it really has changed kind of as a corporate philosophy. So employers are looking at different facets. All of the surveys showed, and I've read 15 surveys in the last 3 months, all of them show a cultural shift in looking at healthcare benefits. And they're looking at physical, obviously, the good health group insurance, good pharmacy benefits, trying to figure out how to help people with high deductibles and putting in value-based plan designs to get people to take care of chronic illnesses, be more adherent with drugs. So all the things that we've been doing, but really a shift to looking at emotional well-being, work-life balance. Financial is a big one, and you're going to see some statistical information on how financial stress is rolling over into the workplace and distracting our employees. And community. I'll just touch on this real quickly. There was a survey done by Forbes of the millennials in the population in the workforce today, and they said that they would statistically, I think it was 56%, if memory serves me correctly, 56% of millennials would take a lower paying job to work for a corporation where their philosophy was more aligned with the organization that they work for. So that's a huge shift from, generations before and the way that we looked at things before. So really, why are your employees' health status and well-being important for the business? And it really is all about, these cultural things that we're thinking about now. And really, you're looking at overall cost and the attributions of chronic illnesses and how that's playing into our total cost, chronic illness conditions, high cost catastrophic illnesses, financial stress. 13% of the workday spent on employees trying to deal with money issues, and absences. 55% of absences are due to family related stress. And then you have that smoker, non-smoker comorbidity with tobacco users. So, employers are taking a step back and looking at their benefits. And really, I think, this time of year, maybe when you go into the December timeframe, I would encourage everybody to kind of take a step back and say within their organization, what is our philosophy on healthcare benefits? Because I think it's changed. And it's changed with the low unemployment and the shift in kind of the marketplace and what's happening with the mergers and acquisitions. It's kind of the perfect storm of what I think employees in the marketplace are looking for in an employer and what they're looking for in benefits. So we're going to talk a little bit about the National Business Group on Health. They surveyed that, basically most of the Fortune 100 participate in that. And it shows clearly a shift in strategy. So employers are looking at their costs and they're looking at what are their cost drivers. And so most of my clients are middle market accounts. So I do have some Fortune 100 clients, but I would say most of my clients are between 300 and 10,000. So kind of the middle market. And I think for them, what we're seeing this year more and more, and it's almost in every single meeting, that our high claimants are driving our trend. So if you have a $6 million spend, we're seeing one person spend $1 million out of the 6 million. So it's skyrocketing pharmaceutical costs, it's high claimants and chronic conditions, and new forms of treatment that are driving the cost in 2018 going into 2019. So of course our strategy needs to shift and we need to put costs back in check. And so we see this as a national trend, even with the Fortune 100. And what we're going to cover today is we're going to kind of move through what large employers are doing to kind of target those 3 top cost drivers. And it's time and time again that we're seeing, the new cancer medications or the new cancer treatments, and some of the new forms of pharmaceuticals. So, I guess for the last 3 or 4 years, we've been dealing with the specialty drugs. So a specialty drug is a biologic living organism. It's usually an injectable and it's usually over $1,000 a month versus the chemical flat pills that we used to get at the pharmacy and bring home in the bottle and take once a day or twice a day based on the prescription. So specialty drugs have really, kind of shifted our focus. Pharmacy is 26% of total spend. So every dollar you spend on medical and pharmacy, 26 cents of it is pharmacy. And that's moving up significantly. And now we're shifting into genetically modified specialty drugs. So it's precision medicine, where they're looking at somebody's genetic makeup and designing the specialty drug specifically for them, or determining that the specialty drug, which pharmaceutical would be better for that person based on their enzyme and genetic makeup. So we've kind of progressed significantly in the realm of new forms of treatment, and oncology and infertility are definitely 2 of the main categories under those. So what does the survey say? This is just some survey data. Again, this is mostly from the Mercer survey, our sister company, part of Marsh, our organization, and the National Business Group on Health. But for the 6th year in a row, we're looking at about a 5% increase in total expenditures, and that is before plan design changes. So, companies are looking at modifying plan design, looking at tweaking things. A number of the initiatives that we're going to discuss here today to get that down to a 2 to 3% trend for the year. But if you look at what the costs were per employee in 2018 versus 2019, we've moved up. And again, the excise tax has not gone away, and we're over that. So that's something to be watchful of and concerned about. Employer contribution and payroll deduction, the mix between what the employer's picking up versus the employee has changed 1%. So in 2018, it was a contribution where the employer was paying 70% and the employee was paying 30%, and that's shifted towards employers picking up an additional percent of the cost. And again, that's just the payroll contribution. So that's the $14,800 divided by the employer versus employee. And then on top of that, the employee has their out-of-pocket costs at the point of service. This is a good graphic, and I know I use this slide a lot and we update it every year, but according to the Mercer survey, it's between 4.2% and 5% is the average increase in 2018. And if you look at what we just kind of set the table and talked about, for years we've been in the consumer generation where we're cost shifting onto employees. We're looking at deductibles, we're looking at coinsurance, and we're shifting responsibility to the employee in those consumer-directed health plans with high deductibles. That's shifted. And I have to say that in the last 12 months, in the last 4 to 5, when we're planning for open enrollment this year, I have seen a significant shift with the C-suite saying, I'm not going to shift any dollars back onto the employee. We need to figure out how to make plan design changes and implement new programs, cutting edge programs to control costs without shifting onto the employees. So we're now in the generation of value-based plan designs, and we're going to talk a little bit about those initiatives and how large employers and mid-size employers are really looking at 2019 as the year. Right after open enrollment, they're going to get started in looking at utilization, looking at what's driving cost, look at the top disease categories, and putting in value-based plan design initiatives in 19 for 1/1/2020. And those include the high cost, high tech, catastrophic healthcare that's driving cost in the way of saying to employees and their members, we're going to institute a Center of Excellence program where we're going to develop a narrow network for certain types of diseases, and we're going to incent the members to use those narrow networks when they do have, let's say, cancer. So somebody's diagnosed with a type of cancer. There's 11 cancer hospitals in the United States, and the narrow network with your carrier might be, the Mayo Clinic, MD Anderson, Sloan Kettering, some of the top-notch cancer facilities in the United States. For those employees to go there to receive care, the value-based plan design incentive would be, we'll cover half of your deductible and pay your travel expenses and the expenses for a loved one to go with you for that treatment. Or it might even be a concierge service where if you use a service like Best Doctors to validate the best course of treatment for a catastrophic or high claimant, we're going to waive your deductible. We're going to cover the deductible if you follow one of the guidelines that they've set or one of the paths of treatments. So that's a value-based plan design, and that is definitely what most employers are looking at implementing for 2019 for 1/1/2020. So we've covered a lot of these in the various power lunches that we've done in the last year. But the top, the survey says, and this is fresh data, the survey was done this past summer, so this is hot off the press. It hasn't changed much, but some of the strategies have changed. And definitely, I think the paradigm or the focus or the philosophy of what benefits need to look like and what we need to be designing in 2019 for the future. So the high cost claimants are definitely driving our trend. Specialty pharmacy, definitely a huge cost driver. And again, something to be very mindful of, most of those specialty drugs And a lot of the oncologic cancer drugs that are delivered in the doctor's office are going through your medical plans. They're not going through your pharmacy plans. So when you're looking at utilization, you have to capture both pieces in order to get the whole picture. Specific disease conditions, rare or unusual diseases, and the new treatments are definitely driving costs. And then here are the top initiatives, and we're going to give you a copy of these slides so you don't have to jot everything down or worry about writing things down. You'll get a copy of the slides at the end of the presentation. But the top new initiatives implemented for 2019, some of these are new. The top top initiatives for the year are looking at more virtual care solutions, telemedicine, third-party concierge services for high-tech catastrophic care, centers of excellence for certain disease types and certain, we're going to go through kind of the top 5 categories of developing centers of excellence, and how employers, so you might be sitting there thinking, that sounds great, I want a center of excellence, how do I do that? Employers need to work with their carriers, and their carriers identify the centers of excellence, and then you put a value-based plan design in place so that you're incenting your employees to use those centers of excellence through those targeted illnesses. Transplants, cancers, infertility is another big one where you're targeting certain providers who have higher quality and higher success rate. One of your members is using infertility benefits, they're able to go to a center of excellence and perhaps have a lower copay or maybe a more robust level of benefits. So those are all key initiatives for the coming year. So again, the top strategies for 2019, and this is from 3 or 4 different surveys. It's showing that telemedicine is something that 96% of large employers are going to be doing, and I will say that even mid-size employers and small employers are developing a telemedicine strategy. It's less expensive, and it's the way our workforce wants to get healthcare. They want to be able to call somebody and do a WebEx or a video conference, get their prescription drugs, and they'll get care quicker and they'll get their medicines quicker instead of waiting, to find time to go to the doctors. So that is kind of a key initiative and it's a top strategy being considered. Centers of excellence, just due to the dramatic shift in the utilization and the high claimants. And the other piece of that, and we're going to talk about it in a minute, is the centers of excellence the landscape of medicine is changing so quickly. It's changed dramatically in the last 12 months. And there are places, hospitals and providers that focus on just one thing and they do it the best. And they have the most cutting edge technology and the treatments for those. So centers of excellence, I think, are going to become more essential. Not even a nice thing to have, but more essential in a good medical plan. And of course, navigation tools. We've shifted the responsibility so much to the employees and their members. Employers are looking for ways to help their employees with some of those strategies. So again, not to beat a dead horse, but the consumer-directed health plan generation of shifting onto the employee was good, and it got people to go to the pharmacy and ask for generics when they got a $300 name brand drug. But that's not going to solve the long-term problem and cost containment on the trend we're seeing, because it's really the chronic illnesses, the high claimants, the specialty drugs, and now the new pharmacogenomics that are out on the marketplace that are driving our costs. So large employers and small employers need to have a game-changing shift in strategy in 2019 for the future. So I wanted to put a couple of slides in here on pharmacogenomics because I just want everybody to be very well aware of what's coming. And it's here. It's not coming, it's here. So the era of specialty drugs has morphed into a new precision medicine era where we're seeing a shift of the way of thinking to really how we're getting care delivered. And the next couple of slides we're going to go through are really, there's pharmaceuticals now that they're being targeted based on a person's genetic makeup. Cancer is one of the ones where I am a half glass full kind of person, and I'm very positive, and I really feel like what we're seeing in the world of oncology right now is such a game changer. I really do feel like they're going to make headway and solve a lot of the types of cancer because of the better understanding of the actual cancer tumors, how they function, how they combat our own immune system, and some of the new pharmacogenomics out on the market. So they're actually looking at somebody's genetic makeup, right? So they're doing tests and they're saying, okay, here's the person's genetic makeup. And right off the bat, they know these three things are not going to work because of the person's genetic makeup. The best fit for them is this particular specialty drug, and this is the way we're going to administer it. And there are some tests right now in FDA approval process. They're in clinical trials right now where there are pharmaceuticals that are being delivered to the patient in the hospital. Right now, there's one that is a 21-day stay for about $700,000 to $800,000, and it's a pharmaceutical infusion inpatient. And it is going to be solving some of these types of cancers or treating them much, much better. And if you look at our landscape, back to the centers of excellence and why we should be thinking about looking at what hospitals do things with the best success rate, if you look at what's happening in the marketplace, statistically, 2/3 of oncologists have stated that they can't keep up with all of the information coming at them and all of the research and development and the genomic pharmaceuticals that are being developed. And if you look at cancer in specific, there are places that are far ahead of other places. And that's where employers are saying, hey, if we're going to spend all of this money and offer these benefits, we want to make sure that the person's in the best setting with the best provider with the most cutting edge treatment. So cancer is one of them. I'm going to flip through these next couple of slides a little bit quickly because I want to cover some stuff at the end on the pharmacy piece. But cancer's a big one. I think I slipped. Yeah, there we go. Transplants are another one where employers are looking at centers of excellence and they're not allowing people to have transplants locally or not at a center of excellence. And that's a value-based plan design just without the benefit or an incentive. It's really, if you need a transplant, you must go to these facilities in the narrow network or your coverage is either less or none. So we have some plans that are doing that. Rare diseases, the high cost, high tech rare diseases, it's a finite number of people afflicted with them, but the cost to treat it is so extraordinary that if you do happen to have one person in your population with one of these rare diseases where they have a solution that's very expensive, it will hit your stop loss. And if it's ongoing, it's going to be lasered in the second year. So it's going to be a cost driver, and it's going to be something that you have to deal with. Premature births, another big one. Many companies have expanded the infertility benefits within their benefits programs, which has led to high cost births. Air ambulances, this is interesting. There's legislation pending right now to combat the high balance bills. You know, the air ambulance swoops in, picks up the injured person, gets them to a hospital, and then the employee or the member's left with a huge, enormous balance bill. So they're trying to fix that. It's been such a big problem that it's actually now in legislation. Cost of dialysis, very high. Again, this is where you can put plan designs in place for site of care, where you're saying to a person, you can get dialysis, but you have to get it through home care versus an outpatient setting, which can save you $200,000 to $300,000 per year if it's in the right site of care. congenital birth defects. Some of these can be fixed with the genetic editing that's being done in the medical landscape today, which is cutting edge technology and really solving birth defects not only for the baby, but going forward for generations after them genetically. The fix will be part of their solid DNA going forward. So the value-based plan designs, just to kind of wrap it up, 48% of employees are implementing some type of initiative to combat the high cost catastrophic care that's driving our cost and get members to be more engaged. So if you look at the last couple of years, we've been cost shifting to make employees and their members more conscious of what the costs are. You know, when they go to the pharmacy, the $1,000 drug used to be a small copay. Now it's a high deductible plan and it's coming all out of their HSA. And people are taking note to say, maybe there's another generic alternative. Maybe I don't need this expensive drug. So now we're shifting the value-based plan design to incent people to look at, you know, if you have cancer, if you need a transplant, really focusing on your high cost claimants and getting them to participate in disease management, narrow networks, centers of excellence through these value-based plan design initiatives. Second opinion concierge services are huge coaching tools, again, all based on the value-based plan designs where you're incenting their participation in these. And so if you look at clearly the medical plan surveys are shifting onto the delivery side and looking at better outcomes and higher quality and pushing people through value-based plan designs to really support better management and have the employee have better participation in their care. And then wrapping it up, I wanted to just put some key facts in here on the pharmacy. 60% of large employers carve out. A lot of them are using coalitions to get better pricing. Specialty drugs in 2020, 9 out of 10 of the top drugs are going to be the specialty drugs. And some of those price increases are unprecedented. We have our first $10 million drug annually out on the marketplace. And it's something that everybody needs to be watchful of. The top 10 specialty therapeutic classes are still inflammation, multiple sclerosis, and of course, oncology. 50% of drugs, I already said this, but I want to say it again, 50% of your specialty drugs are running through your medical plan, not your pharmacy plan. So you need to capture both. You need to look at the pharmaceuticals, the injectables that are running through your medical plan when you're looking at your pharmacy expenses. And then I populated the next couple of slides in here, and these are survey facts. So we're not going to cover these, but employee finances, I really want you to take a look at a couple of these slides when you get the deck, and just kind of roll through like specifically what's driving employees and impacting production with distracted employees, the new debt being brought into the workplace from their student loans, and average credit card debt. Those are stressors in the workplace, and those need to be addressed on the mental health benefits, maybe some strategic financial planning programs for your employees. Those are all being incorporated into your new benefits philosophy. Leveraging technology. A lot of companies are using the Apple devices to, do competitions on walking and steps per day, and a lot of the technology, even, Google and Amazon are using Alexa to remind people to get their prescriptions refilled, or even, if they take 4, pills a day, to remind them to take their pills. Huge move to voluntary benefits. Again, I said this at the beginning of our presentation today, that the millennials value the pet insurance, they value the supplemental voluntary benefits just as much as they value their medical plan benefits, because they like the convenience of one-stop shopping and making things easy. I wanted to put this voluntary benefits slide in there so that you can see what some of the options are that are being considered by employers. again, you can take your leisure and look at all of these different opportunities that folks are thinking of putting in their plan designs. And then, of course, next month, we're taking the month off because I'm having eye surgery the first week in November. And I won't be able to read through emails and stuff. So I'll be a little bit behind the second week in November. So we're going to take November off. We're going to reconvene our power lunch on December 5th. And I wanted to take a step back and do the gearing up for 2019, how benefit strategies are taking fold or undoing our traditional way of thinking about benefits in our almost zero unemployment world. So kind of, again, taking a step back and looking at the holistic approach to benefit plan designs and really gearing up and helping you guys take a step back and really recognizing what top performing companies are doing in the workplace and how they're designing benefits. So that wraps up our power lunch for today. I was almost exactly at 35 minutes. So I apologize that we were about 5 minutes over, but we did cover a lot in those slides. And obviously I'm here to help. I'm always here to help. So if anybody has any questions, comments, you want more information, my information is contained within the deck that you're going to get, and my contact information is right there, so feel free to reach out. And Kelly, I think you're going to share these slides in a follow-up message to the participants, correct?
That's right, Marybeth. Thank you for a great webinar. All of our participants today will receive an email tomorrow from University Conference Services, or the sender may look like Mid-Size Retirement and Healthcare Plan Management Conference. We will send you a link to the recording that we'll post on YouTube and the PDF of these slides. And feel free to join us and register in December for the December Power Lunch and catch Marybeth at one of our 2019 conferences where she does fabulous workshops and is often a keynote presenter. You will not regret your time spent there. All right.
Great. Thanks, everybody. Have a good rest of the week.
You too. Bye-bye.
Bye-bye.